Welcome to another episode of Soul Focus Radio. We're your hosts, Martina
and Martin.
And we're missing Cyndi today, but definitely thinking of her and excited for her to join us on one of our next podcasts. How are you, Martin?
Absolutely. I'm doing really well. Yeah, definitely. It's been a minute since all three of us have been together. So I'm definitely looking forward to, the near future when Cyndi joins us, but I'm doing pretty well. I'm just getting over being a little sick. I really felt like I might've had COVID, but I tested negative. So I'm going to assume I didn't have it.
That's a good assumption. Are you feeling better now?
Yeah, a little bit. Today was definitely the best day I've had in about a week. So I'm definitely feeling better for sure.
Oh, I'm glad you're feeling better. It's definitely is the time where I feel like maybe because I just got COVID for the first time, but I feel like more and more people I know have been testing positive who have not gotten COVID the whole pandemic. So be careful out there. Wear your mask.
Yeah.
Please.
Yeah. Well, I definitely wear my mask. I live here in South Florida, so very often I'm the only person around many people who are wearing masks. People are really starting to look at me crazy, but it's okay. Cause I'm still going to keep wearing it. So, but, everything's good with you and the family?
Yeah, we're good. I think, like I said, last episode, we are just recovering from COVID. So we're definitely getting better. It's taken us about a month to really get back to our full selves. So it hits differently. It's a weird virus.
That's what I understand. Well, I'm glad you all are recovering though. That's good news. That's really good news. So let's talk a little bit about today's episode that you hosted with a couple of very special guests.
Oh, amazing guests. So we had the pleasure of welcoming back Cyndi Carnaghi-Collins, who joined us for our initial conversation, or our second conversation about healing from trauma. And she invited her good friend, Dr. Neelo, who's a pediatrician, to join us in a conversation specifically around healing from childhood trauma. What does that look like as supporting people healing from childhood trauma, whether that's in the medical profession, social work, or just in our community? And then also personally, how do we heal from childhood trauma? So I'm super excited for us to dive into that conversation.
Yeah. I'd say let's dive in because, again, as the resident engineer who doesn't really know how to engineer, but still does it, I get to listen. So I got to listen, and now I'm excited for our listeners to hear all of these pearls of wisdom that you all were dropping on these episodes. So with that, let's go.
There is nothing more powerful than communication because we all have to do it, and we're all doing it on some level all the time. When we are talking to ourselves or thinking, that's just another word for talking to ourselves, which means that we are doing what? Communicating with ourselves. When we are verbally speaking to other people, when our body language is demonstrating communication. Communication is so important because the world runs off communication. So when you power up your communication, you essentially power up your life. At the Soul Focus Group, we invite everybody that comes to really delve into powering up their communication, transforming the way they listen, transforming the way they speak, transforming the way they connect to people, because that is where our power is. Power up your communication, people. We all need it.
Hello. I am so excited to welcome two amazing guests, Dr. Neelo and Cyndi. Hello, both of you.
Hi. Thank you for having me.
Hey, Martina. Good to hear you.
Thanks for coming back, Cyndi. We're super excited to continue our conversation. How are you two doing tonight?
Fantastic.
It's absolutely. I'll second that. Fantastic. Great to be on.
Great. I've been really looking forward to our conversation now for a couple of weeks. So just thank you both for making the time to join us.
Absolutely. My honor.
Well, for those listeners who maybe didn't catch Cyndi on one of our last episodes, I wanted to give an introduction to Cyndi and then, welcome Neelo on our podcast. So for those of you who didn't tune in a few episodes ago, Cyndi Carnaghi-Collins, she is her second time being on our podcast, third actual podcast. She's a social worker with so much expertise and wisdom around supporting survivors of trauma, and really specifically community, systemic, and sexual violence. What's incredible is that she has a huge understanding around the impact of the race construct on our socialization and humanity, and has worked all over the country coaching on race equity and using data to drive dialogue and outcome. And something that I just learned about her, which is incredible, is that she was named one of 40 emerging leaders under 40 for New York City and New York State. So in 2021, congratulations, Cyndi. That's amazing.
Congrats, Cyndi. That's amazing.
Yeah, thanks, guys. Appreciate that.
And then Cyndi introduced us to Dr. Neelo. So we're super excited to welcome her. Dr. Neelo is a pediatrician with a focus specifically on child abuse pediatrics. And she's worked as a full-time pediatrician, both at a federally qualified health center in Yonkers, New York, where she really created a pediatric integrated trauma team and is now bringing that expertise to a pediatric specialty group in Westchester County, New York. Welcome, Neelo.
Thank you so much. It's really great to be with you.
So really looking forward to our conversation today about specifically healing from childhood trauma. And, what I've been really thinking about is, just like with racism, such an important piece is how do we define trauma, and kind of using that as sort of our first stepping stone before we dive into this conversation and really move into that conversation to focus on healing. So I'm really curious from both you, Cyndi, and Neelo, kind of how have you come to understand and define what trauma is?
That's a great question. I think trauma is an event or series of events, circumstances that are experienced by an individual as harmful, either physically or emotionally, and it has lasting effects on the person in some key core way. So, and that what is experienced as a traumatic event, one person may have a different experience than someone else to the same event, but it's those core sort of impacts in terms of it being a lasting effect.
Yeah, I would agree wholeheartedly. I hold that same definition. I would say also, just for me, it's any event that threatens your life, right? Mm-hmm. And I say your life because, and I don't necessarily mean our physical life. It can be our spiritual life. It could be the life that we understand. It could be the lives of someone that we love or care about. It can be the way that we understand and, are connected to ourselves. And so it disrupts that really deeply, and kind of upends our worldview. Somebody explained to me, you gave me an example, that if you place somebody in a room and you ask them to look around the room and see where everything is placed in the room, and then you shut the lights off and then run around and flip everything over and change everything around them, and then turn the lights on for them again afterwards and ask them to observe the room, that chaos, that experience, that is what trauma at a very, very low level can feel like, and can be experienced. So I would just say that that's something that, my experience, I've also kind of helped define trauma for me.
Wow. Thank you both. Cyndi, that description that you gave me a really physical sort of experience, imagining being in that dark room and running all around, just that feeling of uncertainty.
Mm-hmm.
And something you both really highlighted on in your definitions is the lasting effect of an experience, a lasting negative effect of an experience, and how people can go through the same events, but their experiences of it can be so different. And it makes me think a lot about all of us in our work as clinicians, thinking about how does trauma continue to live in our bodies and live in our nervous systems? And how is that one of the manifestations of the lasting effects of a traumatic event?
Yeah, that's a really good point that you bring up. One of the things that we know about traumatic events and how it impacts the body is that it causes like a toxic level of stress. There's, positive stress response that we have where doing something like a podcast where you have a little bit of an elevated, stress response that kind of helps you, do what you need to do. Or a tolerable amount of stress is a little bit higher. But if you have a good buffering effect to that stress, a stable relationship, someone to kind of get you through that, then it can go back to a normal non-stress response. But then you kind of can tip over to a toxic stress response in the body with a prolonged stress or the cumulative effect of many traumatic events. And that, when it's not able to be buffered by a safe, stable, nurturing relationship or resilience building sort of activities, that then causes a lasting impact in the body. So that stress response goes unbuffered, and it's almost like a thermostat that doesn't turn off and keeps pumping out heat. But what's getting pumped out into the body is excessive amounts of cortisol, the stress hormone, and that has effects on the immune system, on the brain. And when we talk about healing from traumatic events in childhood, well, one of the things that happens in childhood is the developing brain. And so all those, connections are at risk, and they're very vulnerable, and they don't develop in the typical ways. And it leads to long-lasting effects, both in behavior and in actual, medical hyperinflammatory sort of diseases like asthma or ischemic heart disease as adults. And one of the final ways that it can actually impact genes and how genes are expressed, that's called epigenetics. So we have a genetic code, and that is something that is stable and inherited, but the way those genes are expressed are controlled by things that kind of sit on top of those genes, which is why it's called epigenetics. And stress and the stress response in the body can actually impact which genes are expressed, which are turned on and which are turned off. And that can also be heritable. And that's one of the ways in which trauma, it can be imprinted in our bodies in a multi-generational way as well.
Yeah. And, it's interesting because oftentimes what we observe and what we see is what Dr. Butt, what Neelo just explained to us, right? Which is the outcomes of trauma. But we don't necessarily always know whether or not a trauma exists, but we can look at those outcomes and we can say that something is going on, right? But we haven't necessarily been trained or socialized in a way to identify those outcomes as being symptomatic of a trauma. We look at it as symptomatic of something else, but really deeply in our society, we need to start looking under the surface a little bit and starting to see these outcomes as being guideposts, right? As being arrows that are pointing us in the direction to start our healing journey. And we don't necessarily always do that. We kind of see those symptoms and we hold them as in isolation and don't think about them as symptoms of a traumatic event. And that puts us at a disadvantage as we're trying to intervene and trying to promote healing. So it's just something to keep in mind that oftentimes what we see is just symptomatic of that underlying trauma we don't always identify.
Absolutely. And if you kind of put that trauma lens on in a clinical setting, some of the things that you are seeing a child for, like I have a lot of kids who are referred to me for, evaluation for ADHD, attention deficit hyperactivity disorder. And that, can be purely ADHD, but it can also be a symptom of a traumatic event and toxic stress on the body. So it's kind of knowing that lens is there and to kind of look through that lens and kind of see what you can tease apart.
Well, I'm so glad you both spoke about that, because I think so often, I know at least in my clinical experience and my clinical training, so often we look to something else as the cause instead of really that root cause. Like I'm thinking about how we're talking about the long-lasting effects of trauma, and we know, and we'll get to talk about the ACEs a little bit later down the line, but we know people who've experienced adverse childhood events have higher risks of, like you mentioned, cardiovascular disease, diabetes, all these things. And when I think about how we talk about those diseases and the prevalence of those diseases in communities, I feel like in my training, at least, we overlook the role of trauma, both on an individual and on a systemic level, right? Like we say, oh, people in this group are genetically predisposed to diabetes.
Right.
And without even thinking about A, the epigenetics, like you said, Neelo, or B, like Cyndi, what you were saying, what is actually the root cause and how are these guideposts of the underlying systemic causes?
Yeah, I mean, it's one of those things that we've kind of shied away from, I think, and I spoke about this in the first podcast I was on, and it's difficult, right? If we were to start to really unpack and think and experience and truly sit in space with folks who have experienced not just individual traumas, right? We're talking about collective and chronic stress. It's overwhelming, right? It's overwhelming to consider the amount of experiences that folks have had that have led them to a place where their body is not performing, right, at its optimal functioning, right? That they're having some serious health concerns because of a history of chronic stress and trauma. Like that's a lot, right? And so we don't really even train social workers to sit. And I'm a social worker, and I would say we don't really even train social workers to be able to sit in that reality and to be able to hold space for that. I don't know if physicians are trained to be able to hold space for that reality also, and to be able to hold and to create, environments where folks are able to bring that and to talk about it as being as something they've experienced that's going to help us, identify maybe a treatment, right? Or maybe, or even just holding space so folks can talk about their experience, which is healing in and of itself. So I want to just, reiterate what I had said in the first pod. We just don't hold space. And we're not trained that way. We're not experienced that way. We're not socialized that way. So as we're having this conversation, this is creating that space here. But we don't do that as a society, for sure.
For sure. And in clinical training, I agree. We don't, I wasn't taught how to do that. I learned that through my fellowship. I learned that through my interest in this and spending time with people like Cyndi and kind of learning how to do this better to serve my patients and their families, because we will ultimately do a huge disservice if we don't start really incorporating this into our daily practice and, making everything be like trauma-informed care. It's kind of like universal precautions. We learned how to do all that in the 80s. This is kind of how we should approach everybody through a trauma lens, not just high-risk, quote-unquote, groups. It's everyone. Everyone is at risk. And as we have now in our society, huge collective traumas that we're enduring that also need to be addressed for sure.
Yeah, I mean, our medical system, like you were saying, Neelo, my experience of it is not set up to hold space because we're given 15 minutes to sit in space with people.
My genius, my power, my optimal functioning. My genius, my power, my optimal functioning. Repeat after me. My genius, my power, my optimal functioning. That is the jingle of the Soul Focus Group, because we are dedicated to helping you recover your genius, your power, and your optimal functioning. We want you to recognize the unique way that you comprehend things, express yourself, experience, and create in the world. We want to help you recover your genius, your power, your optimal functioning.
So I'm really glad, Cyndi, that you brought this up again, just the importance of holding space to acknowledge. And we kind of talked about it last time. Sometimes it can feel uncomfortable to hold that space for people to share or at least acknowledge our traumas. And I really am hoping for us to focus on how do we support people healing from childhood trauma. And so I'm really curious, from both of your experiences, what are some pieces that you think we should all know, or what are some steps that we can take to support people both, in professional roles, whether as clinicians or in I feel like any profession we're encountering people who have experienced trauma, and as a community, because what I'm hearing is it's taking a transformation of how we've been socialized to be able to heal from trauma.
So, I think the first thing is to acknowledge that as a society that there are some really awful things that have happened to our kids, right? And we're talking about specifically healing from childhood trauma and living in a reality, that isn't always protective of our most vulnerable, citizens or those folks in our society, especially young people. I think acknowledging is the first step to healing, right? Is to say, like, something can happen and things have happened. And how is it that we're creating spaces where folks can bring themselves and their whole selves into, so that we can see them fully and clearly. And I think that's a really complicated thing to do, because again, if we were to talk about the spirituality around trauma and the spirituality around healing, what we would say is that, like, the wholeness of people is what helps folks, heal. And when people are not whole, they struggle to heal. And what creates wholeness is connection. And so, creating spaces where folks can bring their fullest selves, that's step one. Acknowledging as a society that things have happened and will continue to happen until we start to acknowledge them out loud is, part of that step one. And then after that, it's creating collectives of folks like this, like between, physicians and social workers and folks in the spiritual and social justice movement, to really have dialogue around our own collective traumas and what has encouraged us to heal, and modeling that externally. So I would say that all of those things are a beginning step, but I would kick it over to Neelo to think more deeply about, any other ways that you see it playing out in community, and, in our collective.
Yeah, absolutely. Cyndi, that was beautifully said. And I completely agree that community and connection, we talk about when healing from childhood trauma, we talk specifically about safe, stable, nurturing relationships. That the presence of that is a buffering factor and resilience building for children who are undergoing traumatic events, stressful events. And that continues through to adulthood, and that need for community. And that's one of the things where I feel like this pandemic has really kind of fractured that, and kind of put a pause on that, and really affected a lot of people. I mean, we've seen the rates of depression, anxiety in teens double since the pandemic, and we don't have enough pediatricians, enough mental health workers to address that, honestly, in the exam rooms. So going into the communities and fostering those connections, enhancing programs that build those connections, and meeting people where they are in the communities, is really the main way to do it. Getting out of the exam rooms and going to the communities, I believe, is the way to do it. Creating that safe space in offices and other places where people can gather and be vulnerable and share their experiences and feel seen and heard. That is definitely one of the first most important steps of healing from trauma. The total journey of any individual is very different, right? Because we all have different impacts on how the same events, for example, like the pandemic, affect us. But that is, I think, a common first and important step.
Yeah. And, when we're thinking about, steps, it's almost, we don't necessarily, and I think we would all agree when we're talking about healing that it's a process, and there's not necessarily a final journey. And what we've found has been equally as important, as, a step-by-step sort of approach, is also just having self-compassion and compassion with folks as they're on their journey. Because this is not, when somebody's experienced early childhood trauma or complex trauma or childhood trauma in general, we don't necessarily want to fix them. It's not a fix. We can't fix what has happened, right? Like, that's not the goal. The goal is to allow folks to begin to integrate their story into a broader narrative of themselves, and not make it the entire story. And so as we're talking about, holding folks and creating space for folks, and creating space for the wholeness of folks, not just their trauma story and their trauma narrative, And that's a challenge, right? Because these events that happen to folks are so large and so big and can be so overwhelming at times that it becomes their entire identity. The goal is to help folks understand and to see themselves as more than just their trauma story, their trauma narrative, even if it's happened when they were very young and was part of their developmental story as well. And so that's, you know, again, there's no final journey, but that's part of the journey, is starting to integrate that into the wholeness of somebody and not being the entirety of their identity.
I'm really glad you said that, Cyndi. And it reminds me, I think it was Martin in the last podcast who said he realized that I'll never be healed from trauma, but that it's all the process of being on the journey of healing. But there's never really an end point where this process of healing is done.
Yeah, because we can't erase it, right? We can't erase people's experiences. We're not going to erase the pandemic from people's lives, you know, and the impact the pandemic has had. But how do we integrate this, right? Like the pandemic is a perfect example. I just said prior to this podcast when we got on, you know, Martina and Neelo, I said, you know, I thought we were past this COVID, it's exhausting. We're not going to take that away. We can't make that go away. I wish in some ways we could for everyone's, you know, trauma stories, but the reality is it does integrate. We do integrate that. And that is the goal of any trauma treatment, is the reintegration of the narrative, to making sense to the best of our ability of what has happened. And then looking for unique outcomes. Like, where is it that our life did not follow the path that we expected it to because of this trauma story, this trauma narrative, this experience? And being able to point to those as proof that our lives can be different, that we can experience something different. We can experience safety. We can experience security, we can experience connection and intimacy, and all the things that, you know, especially sexual trauma, you know, is my area of expertise, especially, you know, when it comes to sexual trauma, those are things that are really interrupted. So something to just, you know, keep in mind that's what really the goal is, the reintegration.
And I feel like that really connects with what you were saying earlier, Cyndi, in terms of how do we create connection? And you said that through wholeness, we create connection, which ties exactly in what Neelo, you were saying in terms of having these nurturing relationships as a protective resilience factor.
Yeah, absolutely.
So something that to me is kind of a data point that really highlights the power of these healthy, stable relationships. And Neelo, I think you probably know this statistic better than me because I can't remember the exact detail, but I know that for our youth who identify as trans, there's good data to show that even just one supportive person in their life in sort of a adult role is extremely protective against self-harm.
Absolutely. I don't know I can't recall the specific statistic, but absolutely yes. And that's true throughout the course of child development. Just one safe, stable, nurturing relationship, one person who sees, validates, hears that child through adolescence into adulthood is enough to buffer from serious harm. And that is an incredible thing when you think about it. It takes one relationship like that is stable and ongoing. And when you think about traumatic events in children, when you think about loss of a parent, you know, we're talking about pandemic, loss of a parent through divorce or separation, foster care, those things can really, that separation from a relationship that could be nurturing, or, you know, that need to kind of reestablish that is very important. And to provide that through other means is super important for children to continue to develop in typical ways and not have the maladaptive sort of behaviors from toxic stress that kind of take over the brain, and then can result in what we see sometimes down the line in terms of health impacts or behavioral or social emotional behaviors that come later.
Yeah, and something we didn't really get a chance to touch on yet, but I wanted to see if we wanted to backtrack a little bit, is we touched briefly about ACEs, and I wanted to see if y'all wanted to sort of speak a little bit more about what are ACEs, how do they affect us, and why do we see this impact? We touched on it a little bit, but wondering if we can dive a little bit, if you're feeling to dive a little bit deeper on that topic.
Yeah, sure. So ACEs, that stands for Adverse Childhood Experiences. And there was a landmark study that was published by Doctors Felitti and Anda in 1998, where they looked at about 17,000, I believe, patients, and they looked at the 10 adverse childhood experiences that they were self-reported, and that included emotional and physical abuse, sexual abuse, emotional and physical neglect, mental illness, and incarceration of a household member, substance abuse, I think intimate partner violence, and I believe divorce or separation. Those were the 10. And they looked at those adverse childhood experiences and then looked at the physical health of those patients. And they found two very incredible things. One was that adverse childhood experiences were very common. That in their group, I believe it was 2/3, something 66, 67% of the people in the study had at least one adverse childhood experience, and 10 to 12% had more than four or more. And then the other amazing finding about the study was that there was a dose response relationship. So the more adverse childhood experiences an individual had, the more likely they were to have an adverse health outcome. So if you had 4 or more adverse childhood experiences, you were about 2 times more likely to have heart disease. If you had more than 7, you were about 3.5 times more likely to have ischemic heart disease. So it was really an incredible study that really pointed to the importance of those experiences and how they can impact. We kind of understood for a long time how that could impact emotional health, mental health, but this was something that was showing us that this could impact physical health. And then the next step was to link, how does it happen that way? What is that link, that step in between? And that also is quite impressive in terms of the stress response of the body and how that then impacts development, and it kind of goes haywire in terms of like that it doesn't shut off and causes all those other diseases like the ischemic heart disease, diabetes, et cetera, and asthma we see in high amounts too. Now, since that study, they've added on from the initial 10 to include many more adverse childhood experiences like foster care, bullying, racism, witnessing violence or community violence, lack of access to health care, I believe, and then poverty, food and housing insecurity. So there are a lot more that have now been included as well.
I didn't realize that they had updated that. That's extremely powerful.
Yeah, and important, and because it recognizes that there's so many more experiences that can impact health going forward.
No, what was interesting, what came out of ACEs from a preventative standpoint, and that's something that I think we're really kind of shifting to, is like, how do you prevent adverse childhood experiences? And so, the strategies that came from that study were fascinating. And it's also interesting to look at them in the context of what socially we're experiencing now, and whether or not these strategies around decreasing ACEs or preventing ACEs have kind of come to fruition. So this idea of addressing or making stronger economic supports for families, teaching, social emotional learning, safe dating and healthy relationship skills to kids, connecting kids to adults who care about them, or folks that can really support them, that one adult that can care or support. Teaching parenting skills specifically to parents, to young parents, to parents who are parenting for the first time at a very young age and have very young children. And then of course, addressing our social norms, right? Whether or not we are actually teaching folks that violence is not something that's healthy for a society, right? And that adversity needs to be addressed. And then, addressing, preventative measures around intervening, right? So like we have to like look at how do we intervene when kids and families and young people are experiencing adverse experiences? Are we enhancing victim-centered services, right? Are we addressing victim-centered services? Or are we looking at a punitive approach for offenders, right? Are we enhancing primary care? I think that that's, something that, has been stretched to the limit with the COVID pandemic. And then addressing, substance abuse from a family-centered approach as opposed to a punitive individual approach. Those things that were really important, but wondering whether or not we've taken that seriously as a society and started to implement those things, knowing what we know about this landmark study. So those are, as we're thinking about healing from trauma, we also have to think about how do we address some of these things before they make the impact that we expect them and now know them to do. It's important.
Absolutely. Well said, Cyndi.
It's kind of mind-blowing to think about, what if we treated poverty, what if we treated racism with the same seriousness? And one might argue we don't treat this seriously, but exposure to like a carcinogen, so a cancer-causing agent.
Mm-hmm.
What would our systems look like? And I think we could definitely argue we don't necessarily treat exposure to carcinogens that seriously in our society, but I think we definitely see that as a risk more so than our society recognizes and acknowledges all the things that you both listed as very serious, harmful things that affect our lives and affect our physical and mental well-being and spiritual well-being.
Yeah, I think that's very true, Martina. And I think part of that is perhaps the perception, because it is so common. So, you can look at that commonality of adverse childhood experiences as, so if we all have it, then why can't we talk about it more? And why can't we connect more about it? But there's also this, I think sometimes, because it's so common, well, I had that experience and I'm fine, so you should be too. And it's kind of the opposite of what should be connecting us and allowing us to move forward and holding space for each other. It is kind of this feeling of, yeah, sure, we went through this and now we go and we keep moving. And yes, we want to heal, but we have to go through the process of healing. But that's not, that's not acknowledging that individual experience of a traumatic event, and so that one event may impact one person more so or less so than someone else, but that doesn't invalidate the experience of the other person, and the need to hold space for that person. So I sometimes feel like that commonality can sometimes be a double-edged sword, and it has to be promoted for connection rather than the opposite.
Yeah, I want to just like lift what you said, Neelo, because I think, it's deep in our groundwater and the way we've been socialized in our society to push our way through experiences, and not to be able to hold them as being part of our, like I was talking about earlier, part of our narrative. Like we push through. It's a very, very ingrained and deeply socialized way of being. And I think it's specific, to American culture in some ways, this constant go, go, go without reflection. And I also think that, as I said before, we don't have the skill set as a society to do self-reflection or to really look and to really feel through a process versus just move through it without feeling it. And I want to say that, like, what is one of the hallmarks of trauma, right? It's this disconnection from body, this disconnection from experience, this numbing, right? Like that is a hallmark response to trauma. And I think as a society, if we think about what we have seen and felt and experienced, we're deeply, deeply numbed out, right? We're deeply disconnected from ourselves, from our authentic selves, from our authentic experiences. And so being able to draw that commonality and to connect it's very difficult if you can't first see yourself. And so I think there's a lot of skill building and a lot of unpacking that has to happen around how we've been socialized to deal with our own experiences in this society. And that disconnect that we have been almost, I want to use the word indoctrinated, but it really is just really deeply socialized into. So I wanted to hold, that's a very, very difficult thing to do when you haven't, when your society and your culture doesn't allow for that or doesn't teach you to.
when I think it's what I was thinking about as I was hearing that, Nilo, is it reminded me of the agreements that we have in our soul focus group workshops and trainings. And one of the agreements that we have is respect for your own unique experience and respect for someone else's unique experience. And we really explicitly say we might experience the same events, but everyone's experience of it is 100% unique and 100% their own. And that's something I think it's really telling that we have to put that as an agreement in our trainings and our workshops, because like you both were saying, we're not socialized to even stop to think that or acknowledge it.
Absolutely. It's super important, and it can do a disservice if you don't. So I think that's amazing that you do that.
So have you ever heard of a term called groundwater? Groundwater is another word we use at the Soul Focus Group that means subconscious programming. From the ages of 0 to 7, we are subconsciously programmed. So much information and choices and decisions are downloaded into our subconscious mind, and we begin to start living that life. And even though that life we're living is not the life we chose for ourselves, and it's not until we understand the impact of the groundwater, what the groundwater really is, that we begin to wake up to our own lives and begin to choose what we want for ourselves. At the Soul Focus Group, we bring you to that consciousness so that you can begin to choose the life you want to live for yourself.
Well, I know I overused this word, but that was awesome. Everything's awesome and beautiful because it is awesome and beautiful. And that was an awesome and beautiful conversation. So Martina, I just wanted to check in with you because you just experienced talking to these amazing people and bringing your amazingness into it as well in terms of this conversation around healing from childhood trauma. What are your biggest takeaways from this episode?
So many. I think like we do in our anti-racist work or undoing racism work or building human solidarity work, the importance of that definition. And I think both Dr. Nilo and Cyndi give really clear definitions of what is trauma. And I think that's a really important piece for us to all remember. So, Dr. Nilo talked about it as a difficult experience as an individual that's harmful with lasting negative effects in a core way. And Cyndi gave it nice and simple as it's something that threatens your life, whether that's physically, emotionally. And so I think those are two really important pieces to remember. And to the key, I think, and we talked about this in our last episode too, around trauma, is that we can experience the same events, but our experience of those events are going to be different and how they affect us. And so really important for us to withhold judgment of, well, I went through that same thing. I'm not feeling that trauma. Why are you? And we kind of talked about that with Dr. Nilo and with Cyndi.
Yeah, I definitely got that. And one of the things that really stood out to me was just how down to earth, both of them are. I mean, I know Cyndi fairly well, but it was my first time meeting Dr. Neelofar, and just really, amazed at how just kind of down to earth, given the intensity of what they deal with. And, I feel the same way about you too, as a doctor. But that was just something I really took away, was that rootedness, that I think you have to have. And, in the next episode, you all are going to talk even more about sort of the impacts of trauma on the provider, the healthcare provider, the healthcare professional. But I wonder if you felt that same rootedness and naturalness that I felt today.
Oh, absolutely. And I think there was a moment where Dr. Nilo really modeled how she models speaking with her pediatric patients as a model for parents of just building those safe, reliable, and nurturing relationships as a resilience factor, and validating people's emotions, giving space for us to share how we feel. And I think that was a lot of what we talked about in healing from childhood trauma, is just making space for us to talk about trauma instead of avoiding it like we so often do in our society.
Yeah, I think it's great because really, from my perspective, it's almost nobody that, hasn't experienced trauma on some level, and certainly some people have experienced it a lot more. But, this, especially, I think the way that COVID impacted people, and that was brought up, I believe, in today's episode, and, just the intensity of life as we know it now. There's so much going on in the world that I think is trauma on different levels. As Cyndi Carnaghi says, the the little T and the big T, there's something going on for all of us all the time. So this is such a important, timely, appropriate subject for us to be talking about.
Yeah, it was very rich. I had a lot of learning. I hope our listeners are able to gain some moments of understanding, learning, and wisdom from the conversation as well. I know I did.
Yeah, well, it was awesome. And, I'm just excited to have access to the folks we have access to and for our team. And, just that this is the journey we're all on together. All right. Well, thank you for leading a beautiful and as I said, timely and important podcast for us. Martina, I really appreciate you.
Appreciate you, Martin. Take care.
Absolutely. Take care. And to all of our listeners, we say, we appreciate you very much. We love you. We appreciate you. We love that you're on this journey with us. We ask that you help us grow, subscribe, share with your friends and family, and help us keep growing so that we can be on a journey collectively to heal from trauma so that we can move forward to a more soul-focused life, to a life that's more about creating human solidarity than all of this division. So we ask of you, as always, to please stay safe, stay well, and most of all, stay soul-focused.